Hello, hello, hello. I can't really see who's in, but hey. Tori, I was gonna tag you. Hey girl, how are you? Yes, we are live. I am a few minutes early. I came on in. My guest will be joining me in just a few minutes, but yes, ma'am, we are live. Yes. I would say tag somebody, but you only can tag people that are in the group, so I am well. How are you? Thank you. Just a little something I found in one of the closets. Just something I pulled out. Hello, ladies. I'm excited. I'm always excited. That's a good thing. I'm excited. I'm excited. Tiffany is so dope that. Hey, Elodie. How are you, ma'am? All of my list of people that I had in my head to tag today didn't need me to tag them, so y'all saved me some work. Elodie, I thought about you the other day. I found some things that I have gained weight and I don't fit a lot of things anymore. And I was like, who is smaller than me that would appreciate the goodies that I have found? And I thought about you. But then I also just need to lose weight and get back in my stuff. So, yeah. How are y'all ladies doing? Can y'all hear me okay? Make sure my volume is doing what it's supposed to do. I don't know. I am trying to tag a few people. Girl, yes. I have, yeah, yeah. It's a lot. It's a lot. Okay, so Tiffany is going to be joining us in just another minute or two. Let me see if I can invite her like this. There you go.
Hi,
Hey, how are you, ma'am?
I'm good. How are you?
Okay, I'm not sure if it's me or you. Can you hear me okay?
I can hear you good. You can't hear me?
Yeah, your volume seems a little low.
Let me see. Is that better?
Can someone in the chat tell me, can you hear Tiffany okay? I mean, I can hear you. It was just a little low.
Okay. I'm trying to pull you up on.
This technology, it does whatever it
No.
wants to do at any given
I
time. So
know.
at any
No.
given time. Okay, she says she can hear us both. So maybe it's just me.
Okay. Because I hear you
I'm not
very
important.
well.
I'm not important. So, ladies, if you are in here, I will remind you that this is a private group. So if you're tagging someone that is not in the group, they will not be able to see it. And if you are trying to share it, if you're sharing it with someone that's in the group, they will not be able to see it. So if you are inviting someone in, you will have to invite them to join the group. So yeah, if you are tagging someone, they're not seeing it. And if you are trying to invite someone, they are not seeing it. You have to invite some they This is a private group. You have to invite them to the group. Okay, well maybe it's just me. They say you can as long as they can hear you. I'm not important. They just need to hear you. They just need to hear you. That's good.
I
Thank you,
think
Elodie. Hey, Amy. Okay. Okay, you good on your end, Tiffany?
I'm good. I'm good. I just want to be able to see the chat.
To see the
So if there are any
comments.
questions, let me see now.
I'm trying to figure out why my volume is so low.
Comments. Okay, 16 comments.
Okay. I am actually watching comments on another device because I knew that I wouldn't be able to see them here.
Yeah, that's what I was trying to do. And then all of a sudden, when I clicked in, I forgot how to use the computer. So that's we're gonna be all right.
That is crazy. There we go. I don't know. It was me.
It
Okay.
was. Okay.
It was me. Oh
Okay.
gosh. Okay. We are right at 7:30. So all right.
Okay.
I am portraying. Hey Gwen. As you ladies are coming in, feel free to say hello, whatever the case may be. If you see me going up and down, back and forth, I promise I am not ignoring you. I am watching the comments and the questions on an alternate device because the screen will not allow me to see them as I am speaking with my guests. I am portraying owner, whatever, group maker of Beautiful Black Girl. And tonight is our second. I'm so excited. Tonight is our second live chat. And tonight, okay, not to say I wasn't excited with the first one because I was. I was excited. Let me say this. I love when you guys play along with all the creativity that's in my head because y'all have no idea how y'all gas me up. I come up with ish and y'all go along with it, and I love y'all so much for that. Last week we had not last week, last session of um my friend Shalea. Shalea is a dope stylist and entrepreneur in the Atlanta area. We spoke last week and had an amazing time. This week I am here with my friend and soror, the beautiful Miss. I'm excited. I'm excited because Tiffany and I had like a pre chat to the combo, and I was convicted. I was like, oh my god, I'm going straight to work today. I ain't stopping at Starbucks because ain't no muffin today. I'm going straight to school. I'm going straight to school and drink water from my bottle. There will be no muffin today. And I went to school. So we're going to start this with Tiff. I want you to introduce yourself. Tell us who you are, what you do, what you're going to bring us tonight.
Yes, ma'am. So I am Tiffany Griffin. I'm a board certified adult nurse practitioner. A practice here in Aiken, Tiffany Adult Wellness and Weight Loss, right downtown Aiken. And I primarily focus on obesity management for the management of chronic disease. My biggest thing is fitness for living well. That's the motto of the clinic because I have a passion for fitness and health and have recognized there are so many health benefits associated with being more physically active. And just as a background about me, I've been in healthcare for about 23 years now. And when I went back for my postgraduate education and was doing all this research on education for healthcare professionals, and when I went back for my advanced practice degrees, the biggest risk factors associated with disease was lack of education, um, being African American, and being poor. And as I
Mm,
went through and looked at so many of my patients that I was taking care of, they fit that mostly. There was such a immense lack of education. And what I saw also as a commonality outside of a cancer or some type of trauma that happens, like a car accident, the majority of people are struggling and dying and losing limbs for chronic diseases that are associated with being overweight, so obesity, from eating poorly or not being able to shift and change what you're eating once you've been diagnosed with a condition, and having a sedentary lifestyle. And it was just so incredible to me. People are in the hospital, they're in nursing homes, they're coming into clinic, and they want to get better. They're asking you, well, what can I do? What medicines do I need to take? But when you start to say, well, you need to be physically active, and you need to make these dietary adjustments. It's like, well, just what's the medicine? Like, what's plan B? And so when I decided to open up my practice, one of the key pieces that I decided to focus on was engaging the community from that standpoint. Like, what are we eating? What are we doing? And how is that impacting our overall health?
wow. Your intro brought a lot, and what you presented just in that intro leads me into my first question. What do you think are some common misconceptions about women's health that you encounter like all the time?
Common misconception about women's health is um, that some of the physical ailments that women experience in perimenopause and menopause are just par for the course. There's nothing I can do about it. This is where I am in my life, and that's it. And it's not a fact. These are syndromes. And although the symptoms are very real, I'm not going to be here to say we aren't having hot flashes, but we can impact some
I
of
agree.
those and experiences with our lifestyle modification. And so just this acceptance that, okay, well, this is where I am in my life, and so I just have to deal with it and endure it. No, sometimes I talk to women and they're like, well, they start off, I'm perimenopausal and I have fatigue. What can I do? My first question is, how many hours of sleep are you getting every night? Because that's a lifestyle modification. If you are so swamped with work and you have been running on 4 or 5 hours, maybe 6 hours of sleep for the last 20 years, because you've been raising
Mm,
children, now you're in a syndrome that you can't fight off as easily. But we can go back to basics and say, let's go back to getting sleep, because the Society for Sleep Medicine recommends at least 7 hours of sleep. And a lot of times when I tell women that, it's like, well, I can't do that. Well, just take that off the table. I can't do 7 hours of sleep. Well, can you? You got to look at that. Because if you're fatigued all day, and now your fatigue is causing you to be irritable, it's causing you to be depressed, it's impairing your cognition. So now you've got this syndrome impacting and impairing your cognition. And you've got your sleep deprivation that you've always kind of powered through. But now your body doesn't let you power through it like it used to. Now you're up against more. And then now when you develop a chronic major depression, you have to have medication in some cases, whereas we could have went back to the basics.
This is a toxic cocktail. Like, I'm listening to all of this. But you know what? Okay, and ladies, I will also say this. I can see your comments. So if you have a question, you want to ask something, feel free, drop it in the comments. That's why I have my other device. I will not say my age, nor will I say my weight on here. But at this point in life, I have to be very transparent. This is the first time in my life that I am having issues with weight. I am the heaviest now that I have ever been in my life. I have been pregnant with the baby due tomorrow, and I've never been at this weight that I'm at now. So I don't know this body. I don't know what to do with her. I don't know how to dress her. I don't know what to do. I don't know what to do with her. And I don't have a hard time with lifestyle changes. I can change the diet, I can work out. For me, those are not issues. I can do it, no big deal, and I have. But I hear so many women that are they get those kind. I haven't even had those recommendations. I just knew I had to do something because I had to put this under control. But I hear so many people that have these recommendations, and it's hard for them to adopt a new lifestyle. It's hard for them to change, period. I jokingly said that I didn't go to Starbucks the other morning. I'm really not joking. I really did not go. That was easy for me because I knew I had been stopping every other day. So I needed to stop this right now. What advice, what would you say to somebody that is literally having a hard time with just that, the lifestyle changes? Like, yeah, just incorporating something new.
Sure. So my motto is health is habits. I wrote a blog and I put it up on my website over a year ago about the atomic habits and the habit hack because that book was a great demonstration on how it is shown that small changes over time lead to long-term, larger changes. A lot of
Mhm,
times when people hear behavior or lifestyle modification, they see it as a mountain and not stairs. And so, what I do with my patients, everybody's life is different and it's an individualized approach. And so, I talk to my patients about the small incremental steps we can take and master,
mhm,
and then what we do next. So, for example, if I had a patient that couldn't stop the drinks in Starbucks, they just using Starbucks as an example, and I applaud you because
mhm.
applaud you because being able to make behavioral changes like that is a blessing and a gift. And you should be
Mhm,
really grateful that you have that because it is so uncommon. And I grew up with a mom that was like that. I mean, she got diagnosed with hypertension. She came home, threw away everything in the pantry,
mhm.
didn't eat bacon again. Like she just did it all like
That's
that.
me.
But then my grandmother died and never could make those changes. So it is a
Mhm,
blessing. But what I would say to a lady that say if she had the Starbucks kick and she loved to go to Starbucks and loved the sugary drinks, well, we would sit down with what are the drinks at Starbucks? I would pull them up and we'll go through the different drinks that she likes. Which ones are the lower calorie options? We'll start there. We would start by not taking it away because you can have everything. But instead of the highest calorie option out of this list of five things you enjoy, what's the lower calorie option? And master making those choices and paying attention, modifying. So sometimes, I'll ask my medical assistant. She loves coffee. So if I ask her to go to the store for coffee, she'll always go. But I ask her to get Splenda and almond milk in my drink instead of, full cream and sugar. That was a small change that I made several years ago, but that's kind of how I would do it. I would also encourage my patients, even when it comes to physical activity. I don't ask them to start doing 30, 45-minute routines and hire a personal trainer tomorrow and do P90X on day one when they come to the practice. No, I say, can you give me 10 minutes on a Monday? Just 10 minutes on a Monday. Let's master the 10 minutes on Monday. And then we start seeing, oh, I found 10 minutes. And so, how do we start to spread that out and then build that up? And what they find, even with habit forming, is when you find success in one area, then you're more likely to build on those successes. Whereas conversely, if you're unsuccessful, you're more likely to just give it up. And it's like, I'll start after the holidays. Well, no, that was just yesterday.
Yeah, you
Let's
see that
start
a lot.
again today. So that's how I try to approach it. Just this habits. What is a small change that we can make today? What can we master today? And then let's build on that. Because, too, with adjusting, I always say it's in beta mode. Just because you planned to go to the gym on Tuesdays and then something jumped up on Tuesdays and you can't do it, well, it's okay. It's not a failure because that plan was in beta mode. We were just testing it out. But
Hmm.
now we come back to the drawing board when we realize, okay, well, Tuesdays isn't a good idea because I got three other places to be on Tuesday evenings. Maybe let's choose a better day. And so we look and evaluate each change and see, well, how did that work? And how do we apply those pieces to the next thing we're trying to take? When my patients, they start to see themselves being successful and doing things and participating in lifestyles that they never even thought they could do, they start to gradually build on it, and it feels good
Hmm.
to experience success. And so they build on that. And then before you know it, I have people who are working out constantly, drinking green juices, giving me all kinds of sweet recipes that they can do, that they're using fruit instead of a lot of candies and cookies and chocolates. It's a beautiful transformation to see people do it.
You touched on a couple things that was going to lead to my next question. You in my head today. You talked about losing your grandmother, about her. You talked a little bit about exercise and even diet. Talk a little bit about how that affects lifespan, because I think sometimes we hear, how can I put this without sounding very just, it's not, we don't believe fat meat greasy. We hear it, and we hear it, but we don't believe that, you know what, you can lose your life based on these small decisions. So how, talk a little bit about how, just possibly from experience, how those things affect just your overall lifespan.
Absolutely. So we'll do physical fitness, and we'll also talk about the obesity factor, right? With those lifestyle changes. So if you are obese, you are more predisposed to chronic disease development. And so if, for example, now you're obese and then now you get high blood pressure and then now you get type 2 diabetes, just those two,
Oh Lord.
just me to name a few, you
Hmm.
are immediately impairing your long-term lifespan because then you have to be on medications to manage them. These medications impact kidney function. Unaddressed chronic heart disease is a death sentence, right? It's not compatible with
Hmm.
life. You are more high risk for heart disease leading up to and including stroke and cardiac arrest when you have chronic heart diseases. When you have diabetes, that's something that, a lot of times managed with lifestyle modifications, changing how we eat carbohydrates, being more physically active. Okay, so you don't take care of your type 2 diabetes, you are at increased risk for developing end stage renal disease. We're on dialysis. People don't live very long on renal dialysis.
Hmm.
Additionally, they are at more risk for infections. When you have a diabetic patient that gets a foot injury, they have a high propensity and likelihood to potentially have an infection in that foot, and in many cases, especially in South Carolina, lose that foot.
Hmm.
And so when you're looking at these diseases that you now have developed because of food choices, activity choices, lifestyle, and then not to mention in a lot of our communities, we're predisposed genetically to some of these conditions, right? So you've got to skirt your genetics that you didn't even ask for. But now you've opened yourself up to a host of diseases that have to be managed
Hmm.
because lifestyles can't be adjusted. Additionally, when it comes to physical activity, my grandmother, just using her as an example, one of my favorite people in the world, if not my favorite people after my daughters, and she had a fall, which led to a downward spiral of injuries and problems that led to ultimately her death. Had she been physically active, had she practiced mobility, had she been a little bit more stronger in terms of her lower body strength, it is probable that she may not have had the fall. She may have been able to get up. She may have been able to pull her body around on the ground. And particularly with women, we start to lose bone mass as we age. And so our bones are more high risk to break if we have a fall. If you aren't physically active, if you don't have mobility, they encourage a lot of flexibility training because having weak muscles, having weak bones, and having inflexible muscles push you at higher risk for falling. That's why the trope is like the little old lady slipping and falling.
Mhm.
And a fall after 65 is correlated with mortality risk.
Did y'all hear that? Y'all say that again, Tiffany, because
A fall after 65 is
yes.
correlated with mortality risk. Absolutely. So, it gets very dangerous to fall when you're a senior. And so, we think about going to the gym and being physically active as something that we don't have time for, but you may be saving your life by having strong muscles and legs, especially the lower body. Squats are some of the best things you can do. There's literature out there that has correlated strong lower body muscles with extending your life expectancy. It's not just the booty.
Look, oh, I say it sounds like I'm on the right path. Let's see. Let's see. Oh my goodness. Okay. Now, a lot of what you talk about are like a lot of what you threw out there were like blatant diagnoses. And one thing I feel like we see in our community, I don't know if it's more so men or women, I really can't say, we don't necessarily have these doctor's visits that we should. And even when we do, I think sometimes I am not even prepared when I do have these to ask for. I don't know if I know what to ask for, what I should be worried about, what I should be concerned about. Because I know a lot of people are like, well, for the most part, I feel fine. So I think I'm okay. What are some things that we should be looking for? If I am speaking with my doctor, I should be asking him, what is something that would be like a preventative type screening or something like that? Something I need to be, not we need to be thinking about.
Well, I definitely would just start with because, okay, preventative health recommendations for screening is age-based. And risk factor and gender based. So, certain things, for example, risk for osteoporosis is something that is screened more highly in women
Mhm.
than men. And so also STIs or STD infections is something that's screened more likely in young adults than older adults. So one of the questions you could walk into for your preventative care visit is what are the screenings that are appropriate for my age and my demographic?
That makes sense.
If you have family members that, for example, we're not here to talk about men, but just as an example for men, because a lot of women, wives, they take care of their husbands. They are the healthcare of their husbands, right? They have to track everything. When is it time to screen for prostate cancer? It's a different age bracket if you have a family member. So if you have a brother or a father or a grandfather that has had a history of prostate cancer, you are screened at a different age. Or colonoscopies. If you have a direct family member that has died from colon cancer, you may be screening a little bit more early. Okay. So giving correct history, telling them, knowing what your mother, father, sister, brother, and children's medical history is an important tool to help your provider identify what are the appropriate screenings that you need to be having.
That's a
Okay, so I'm in my
that's
40s. I know that at this age is certain screenings that I should have. Also, telling the truth. I've heard people not be honest. Yeah, I've heard
be
people not
lying.
be honest about their sexual life. If you are sexually active and you are not sexually active with one partner, or depending upon the types of partners you have, there's different screening. If I had a patient come in and they are single and sexually active, but it's not with one partner, I'm going to be screening them for STIs and STDs differently than a married partner that's only having sex with their one married partner.
Hmm.
Also, smoking lifestyles. I ask my patients, and hey, no risk, no heat, no judgment. Do you
That's
smoke?
fine.
Do you smoke? Do you use THC? Do you vape? Do you dip? I try to say, put it all out there. Do you drink alcohol occasionally? Because people get in the doctor's office like, I don't want to be seen as some type of person, and they're not honest. But I'm going to screen you. I'm going to get you checked for lung cancers. And if you're having cough symptoms and you smoked for 15 years, I'm going to get you screened for COPD because God forbid you have a chronic obstructive a cough. When you have chronic obstructive pulmonary disease, is different than a cough if you never smoked before. I know to screen you differently depending upon what your history is. So get somebody you can trust and you feel comfortable with. Because if you feel like you got to go in there and put on airs, that's not the PCP for you.
That's not gonna work. Makes sense. Okay, someone in the chat, Tasha asked in the chat. She asked about. I don't remember exactly what we were talking about at the time. Vitamins. Look, now this one is one that I need to hear because I take those little old lady pill things for the days of the week. I got a
Uh-huh.
whole one of those that I got a whole bunch of vitamins.
Your supplements and stuff in.
It's like ashwagandha, focus gummies, collagen. It's a whole thing of them. I do it every day.
Okay.
So I'm thinking she asked me like, what do you recommend? Like something that would be good for without telling her business. Women in their 40s.
Well, here's the thing. When you go and get your lab work, when I start to say recommending vitamins, I'm going to recommend you have vitamin supplementations in the areas where you have deficiency. As Black women, Black people, we have a high propensity to have a vitamin D deficiency. Because of the melanin in our skin, you get vitamin D from the sun, and we often don't go out in the sun. So we are very well known to have a vitamin D deficiency. So when I have my patients come in, I usually check their vitamin D, and most often they are deficient. So I usually recommend
Wow.
supplementation. So encourage them to go outside in the sun. It's therapeutic. Use your sunscreen. But that's the number one vitamin that I would typically recommend. Women over 40, a women's vitamin with calcium is a great vitamin to take. If somebody has iron deficiency, I would recommend them take an iron or ferrous sulfate tablet. Okay. So, but with that being said, I encourage my patients to eat their vitamins. Before I'm encouraging you to take a supplement, I'm encouraging you to eat fresh fruit and vegetables to get your vitamins. Because not only are you going to get the vitamins and minerals, you're going to get the fiber. And the fiber is going to be assistive with moving the waste out, preventing cancers and colon cancers and constipations that attribute to some other gastrointestinal disorders. So the first thing so if you're not deficient in anything, I don't go around recommending vitamins. They are not FDA approved. And some vitamins interfere with actual prescription medication. So you want to make sure you're talking to your provider if you're on medication before you start taking the various different vitamins that are out there. You can't even eat a piece of grapefruit with some of the medications that we have to take.
You know what? I've heard that. Like I've worked with several people that have not been able to do the whole grapefruit. Yeah, that's funny you said
Yeah,
that.
it's weird. So some things make your blood thinner. So I would definitely, I like a women's multivitamin with calcium. I usually will take that. Vitamin D deficiency is something I see frequently, but I will test for that. That's something that when we pull labs, we can see if you have vitamin D deficiency.
Okay. Someone in the chat said her vitamin D level was a 7.
Yes, that's low. Gwen, I can see Gwen.
You can
Yes,
see
so
it
your
now.
provider should have definitely prescribed you. Um, prescribe. A lot of patients will get it over the counter, but I'm going to prescribe it at a higher um, amount because we have to overcome the deficiency. This is not, see, it's different to take something to maintain versus to take something because you have a deficiency. You got to pull it up to normal and then maintain it.
Oh, Lord.
Vitamin D deficiency also attributes to mood disorder.
Oh, well, I need to get my vitamin D checked because
It's a it's
sounds
a it's a risk factor for depression, actually. Now, some other vitamin supplements that I do like, and again, this is not medical advice. Talk to your provider before starting any medications, vitamins included. But my patients that have some joint discomfort, particularly arthritis, joint pain, losing weight is one of the best ways to get past that joint pain, especially back pain and lower extremity joint pain, hip pain, knee pain, even ankle pain. But especially in the colder months, again, eating your vitamins, I recommend omega 3. So I recommend you take omega 3. People don't like that fishy burp, but I'd rather have a fishy burp than to be in pain. Chew a piece of government. That's just me.
It's,
But
yeah.
salmons, big, thick, fatty fish are great options to get those omega 3s.
Okay. 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 So you hinted on the lose weight thing. In our pre-call chat, Tiffany mentioned something about. I'm going to be very honest. I hadn't checked my BMI probably in 10, 12 years. And it was because I always just assumed I was okay. I was like,
Mhm.
I'm fine. I don't have that issue. And when I checked mine after I called that there, I sent it to Tiffany.
She sent it to me.
I was I was
Chuckle.
I was panicking. I was this close. Hold up. No, was it overweight or overweight? I
Overweight.
was this close to being overweight. I was like, what the hell? So I probably wasn't as good the whole time the way I thought I was. Look, now that tells me I probably was borderline all along. Okay, talk to us a little bit about this whole BMI situation.
Yeah, so the BMI is controversial, especially in Black community, because we have a specific aesthetic that we enjoy. We prefer to be a lot more voluptuous. Um, So we usually, and then there's been some controversy about the BMI and is it appropriate for different races and cultures, or is it more aligned with a Caucasian body? And our bodies are different. Our bodies, what our needs are. From a medication standpoint, from nutritional standpoint, what is registering for our bodies as disease is different, depending Asians, blacks, and white is different. In terms of the BMI, obesity, that's a BMI over 30, is correlated with about 13 different cancers, cardiovascular disease, endocrine diseases, joint pain, back pain, and increased mortality. Okay, so that is obesity, right? That's the one that is the red zone. When you get your weight, and I mean, there are tools on the internet you can figure out your BMI. So you plug your weight in, you plug your height in. It generates your BMI. And a lot of the tools that we have available will just flat tell you what your number is, and it'll give you a little, tell you the range. You don't have to go and read the whole chart.
Yeah.
I tell my patients, I don't want you to be obese because obesity is correlated with disease and cancer and death and pain. You can be overweight. I love to tell my patients I'm overweight because I think I'm short. And so they don't necessarily look at me and think I'm an overweight woman.
Hmm.
And some people don't want to be as small as me. They feel like I'm too small for them, but they don't look at me like, oh, that's out of the range of anything I would want to look like. They're actually very surprised typically when I tell them I am considered overweight in the BMI, and that's perfectly fine because my weight classification, coupled with exercise, a controlled carbohydrate diet, portion control is not associated with disease. I don't have any chronic diseases. But I'm not considered normal weight on the BMI. A lot of times, normal weight is a lot thinner. Now, some people like you are just blessed with curves. Like you just blessed. Yeah, you slim and
And I'm
and
sitting here
trim
thinking I
and
need to look like
curvy.
you.
You're slim, trim, and curvy and tall, right? I'm only 5 feet tall. You're what? At least 5'7".
No, I'm only like 5'4.5".
Well, I'm just looking up high because
I'm
you
usually
look
in
so
really
much
high heels.
taller. That's
I'm
probably
usually in
what it
heels,
is.
so
You're
I'm usually
usually in
like
heels.
5'9".
That's why when I'm looking at you, that's what it is. Because I'm looking at you and I'm always in my mind like you're 5'7", you're 5'7", usually in heels. But it's okay to be And this is me. This is what I teach my patients. It's okay to be overweight. It's not okay to be obese. But once I tell them that I'm overweight, it kind of like they step back and they're like, oh, well, maybe it's okay. I don't have to be normal. I can be overweight, but I don't need to be obese. That's something they can usually accept because my patients, they're coming to me for weight loss a lot of times, and they may want to drop 20 or 30 pounds, but they always say, I don't want to lose my butt. I don't want to lose my curves. I don't want to lose my thighs. And you can keep all of that. But I also like to challenge my patients and say, are the thighs worth the heart disease? Because if your
No.
mama got hypertension and your dad died of a stroke, you are higher risk for these diseases. Are your curves more important than you being healthy and having a healthy heart? Because I have a lot of curvy, beautiful women that I'm treating for hypertension. They can't say yes. So we just have to, I think, sometimes come back to the drawing board about what we value because I posted on my Instagram story today. You can have 100 problems, and then when you have a health problem, you only have one problem. And that's absolutely true. As soon as your health becomes a problem, you you can't go to work. You can't go to the events. You can't take the kids wherever they needed to be. The only thing you can focus on is getting that healing. And we don't need to get all the way there. Like once it's chronic disease, it's very little we can do outside of med management. I want to get it before it becomes a disease. I want to get it when we know mommy and daddy had it. So let's make these adjustments now so we don't get it. And then we can be happy with our new body because that new healthy body is a beautiful and sexy body.
Tiffany, you have, I am not surprised though. I can't believe we've been talking for 35 minutes
Oh my
and
gosh, I wasn't even looking at the clock.
there's so much more that we can cover. We almost need a part two. Thank you so much. Um, I closed my device. Ladies, if you have any questions for Tiffany before we head out, I mean, I think for me, this is very important because there's so many, I feel like as Black women, we're already leaders and you cannot lead if you are not well. And let's be honest, there's so many of us that are just not well. It is what it is. This is a topic that we hear all the time, but I don't think everybody is as you don't always hear it in an intimate setting. There's a huge difference for me from hearing it from someone I know, someone that I can relate to, somebody I can send my BMI over to, and being in this huge situation where that may not be the case. So thank you so much for just taking a few minutes out to talk with us. Guys, if you have a question for Tiffany while she's here, um, drop it in the chat before we head out. One thing I will share, when I introduced Tiffany, I did introduce Tiffany as my soror. Tiffany and I are both members of the greatest organization this side of
The
heaven, Delta
greatest.
Sigma Theta Sorority Incorporated. And what's crazy is we are talking women's health on the brink of losing a powerhouse in our organization. We lost a woman from our chapter, our home chapter, that was an absolute powerhouse. There's no other word for it. An absolute powerhouse
I love
in
it.
our organization. And in large part, for a long time, she suffered with a lot of health concerns. And I just ask that you ladies just kind of keep her family in prayer. That's a lot. It's a lot
It
to lose
is.
it's a lot to lose your matriarch. And my prayers are with them tonight. Yeah. So again, if Tiffany will agree, we'll have to do another part two. We'll have to do a part two. Thank you
Absolutely. I
so
love
much.
it. I could
Thank you
talk it
so
all
much.
day.
Thank you guys for tuning in. Gwen, your what was because I said I was borderline overweight. Yeah. This new number, I think that scale might be defective. I'm gonna check it again because ain't no way. Ain't no way.
Ain't
It
no
was taking
way.
it was taking too long to roll and digitize and stuff, so it might be wrong. Thank you, ladies, for tuning in. I will also say, I said this in the beginning. This is a private group. So if you're trying to tag people that are not members of the group, they will not see it. So this is why I always, every time I post something, I'm like, invite your friends, because your friends cannot see it if they're not in the group. Again, thank you, ladies, so much for tuning in. Not next Thursday, but the Thursday after that, I will be back with my third installment. I don't know if Tori is still on here, but Tori is my guest for the next session. Thank you. Thank you, Elodie. Thank you, Shalea. Yes, Tori will be my guest for the next session, and Tiffany and I will be going to the calendar to see when she can come back. Um, yes, yes, good night. Tiffany, don't hang up because I gotta get a picture. I gotta get a picture.
Oh, okay.
You look so cute. You always
Thank
look cute
you.
now. You look so cute. Let
Thank
me
you.
sit up so I don't look like I'm slouching. Let me see. Hold up.
I think you're muted.
Okay, it did
There
mute.
you go. There you
Okay, so
go.
I got our picture. Thank you guys for tuning in, and I got our picture. Thank you guys for tuning in. You can always go back and watch the replay. Oh, this is the other thing, Tiffany. Make sure you tag your business page and all of your things in the group so everybody can follow you as well. I knew it was something I forgot, so make sure that
Okay.
you go back, tag yourself and your business page and all of the things. That was the other thing.
Okay.
All right. All right, ladies. Good night.